Insurance companies don't care about you. I'm talking about UnitedHealthcare, Aetna, Cigna, Blue Cross Blue Shield, across the board. Private health insurance companies don't care about you. If you're a patient, they don't care about you. If you're a provider, they don't care about you. They care about one thing: profit. That is the only thing that they care about. The goal of an insurance company is to hold on to any of the money that comes into their system. So when you pay a premium, or your boss pays the premium, or your place of employment pays the premium, the goal of the insurance company is to hold on to that money because they use that money to invest to generate profits for their company. So they don't want you as a patient to use your health insurance. That's why they have these plans that have incredibly high deductibles as a deterrent for you to go to the doctor. And they don't want to pay doctors after you see them. I don't know of any other industry where you render a service, you spend sometimes hours with a patient, you submit your charges to the insurance company, and then the insurance company will say, hey, you know what? We're going to pay you for some of that, but not the whole thing. So, it's like rolling the dice every time you see a patient. I don't know of any other field that's like that. And it's really done to leverage how much money the insurance company can hold on to. They'll play games like, hey, send us a note. We need to verify the note of the visit that you had with the patient to make sure that everything was done appropriately. You send the note in. Somehow it mysteriously gets lost. And then they reach out to you again and say, oh, we never got the note. So then you have to send another note in. These are all games, unethical games that insurance companies employ to hold on to the money that's in their system. So if they don't pay it out, there's a longer amount of time that money is sitting in, say, an interest-bearing account or an investment-generating account. Now imagine this. Imagine I go to a restaurant and I order an appetizer, my entree, and dessert. And the check comes and I say, you know what? I'm going to bundle the appetizer and the dessert into the cost of the entree, and I'm just going to pay you for the entree. Can you imagine? I mean, that's basically what happens to doctors. What if I said to the guy at the restaurant, said, hey, you know what? I'm actually going to audit my last 5 to 10 meals here, and I'm going to apply that same principle. I'm going to apply the cost of the appetizer and dessert into the cost of my entree. And now, after doing that audit, you actually now owe me $50 for an overpayment. I mean, these are the practices that insurers, private health insurance companies, UnitedHealthcare, Aetna, Cigna, all of the private plans play these same exact games. You know who doesn't play these games is Medicare. Medicare is a system that's designed to give patients access to care. So there's no games there. You know exactly what you get into when you see a Medicare patient. When you see a private health insurance patient, you have no idea what you're going into, what kind of games they're going to play, how they're going to hold on to money that is due you for having already rendered a service. It's a crazy, broken system. I have no idea how patients and doctors ever allowed for this. I mean, there's a reason why the CEO of UnitedHealthcare made $18.1 million. There's a reason why the CEO of Aetna Healthcare, which was bought by CVS Health, made $21.6 million. There's a reason why Medicaid, private Medicaid insurance plans, Medicaid, which is designed to help those who can't afford insurance, CEOs of private Medicaid plans are making $10 million a year. I mean, to me, that just indicates that the system is broken. We need reform. We need insurers that care about patients and that care about providers, that care about health. That's what healthcare insurance should be all about. And the problem, it's so patently obvious, is with the private insurers. So that's my take. The doc sees through the BS of the insurance companies. I hope you do too. And now it's time to vote. It's time to take these issues into account when you're making your decision for who to vote for. The healthcare system is broken and it needs to be fixed. Let's get it.